Do you have questions about what a spinal adjustment or spinal manipulation is? Hi, I'm Dr. Crockett and this is Dr. Sanders with Zeal Integrated Health, and today we're going to do a little Q&A session with our Dr. Sanders. So first of all, let's just start with what it actually is spinal manipulation or a spinal adjustment.
So a spinal manipulation or adjustment is when a practitioner uses their hands or a tool to deliver a force in a specific direction to a joint.
What's it used for? I think that's probably a lot of people that are interested in this are kind of wanting to know, when would you need a spinal adjustment or manipulation?
Absolutely. Anytime you're lacking mobility in a joint, when you want to restore and enhance that joint's function, or when you want to increase the mobility and flexibility of that joint. It is also great for reducing and resolving joint inflammation and overall reducing the pain that a patient is experiencing.
So the question that I always get when I was adjusting people is, what's the popping sound?
The popping sound, I get that all the time too. What's the pop? What's the crack? Is something breaking? No, nothing is breaking. Nothing is going on. That is gas that has built up pressure inside of the joint, and when that joint's mobility gets restored, it's simply that gas being released.
Yeah, it's just that release of pressure,
Yep.
right? So another question would be, is the manipulation, is that and mobilization kind of the same thing?
So the end goal is the same. You're wanting to restore that function of the joint. The mobilization uses dynamic range of motion and functional stretching to really get that joint's mobility back, whereas the manipulation is what we said earlier, a direct.
It's like a more specific line of drive,
exactly,
is what we might say, or
exactly.
a force is put in a certain direction.
Mm-hmm.
Yeah, okay. So a lot of times you might use both of those types of things
Absolutely.
in treating a patient here.
Nearly all the time on any given patient, you'd use both of those.
So is a spinal adjustment ever contraindicated, or is there a time where you might not want to do an adjustment?
Now, we are able to tell that after a thorough examination. Sometimes in cases of severe osteoporosis or bone cancer, we may avoid an area for adjustment, but that does not mean that that person can't receive an adjustment somewhere else on their body.
Yeah, and there's different techniques that you use at different times.
Absolutely.
So obviously, once the exam's done, you can identify what's going to be the best treatment approach, customize that treatment approach for the individual.
Exactly.
So hope this helps explain a little bit about spinal manipulation and adjustments, and check out some of our other videos below.